Let's take lumpectomy first, shall we?
Sure.
All right, we have a graphic on what a lumpectomy is, the surgery. Doctor, walk us through this and just give us some more info on it.
Right. So lumpectomy entails removing the area of cancer from the breast, but preserving or conserving the breast. And so what we'll do is create an incision on the breast and remove the area of tumor, and then take a normal rim of margin or a normal rim of tissue all the way around the tumor to ensure that all the edges are clean. That surgery takes approximately 90 minutes, and it's outpatient surgery, so the patient's able to actually go home the same day. Recovery time is minimal. Some patients go back to work the next day. Some take a couple of days off and then go back to work. And the recovery time is excellent for the patients. And so if a patient has a very tiny tumor, let's say in a large breast or a moderate-sized breast, then they might be a very good candidate for lumpectomy.
Okay, and just like you said, 60 to 90-minute procedure, outpatient, often requires radiologic localization, 1 week recovery time, that's fantastic, and they return to work the following day as well. What if, I'm just, asking this question, because what if a patient says, well, you know what, I know you're telling me lumpectomy, but, I'm paranoid and I want a mastectomy. Do you honor that?
So I make sure that the patient makes a very well-educated decision, and we talk about what their risk factors are for recurrence and their risk factors for developing a new breast cancer. In very young patients, they can have higher risk of local recurrence or for developing new breast cancers in the future because they have many years of life ahead of them. And so in an extremely young patient that desires mastectomy, it may make more sense sometimes to consider mastectomy, or especially in someone who's a genetic mutation carrier that has higher risk. But if I see a 65-year-old patient with a tiny tumor, with no family history, no genetic mutations, and she's trying to convince me to remove both of her breasts, I usually will try to explain to her that's not a wise decision, because that can have several repercussions, and it's a major surgery that can be a huge recovery time for them. And I try to convince them what I think the best option is for them, but ultimately it's the patient's decision. And if it's something that they're not going to be able to live with doing screening every year, and they're not going to be able to sleep at night because they're so worried about their risks of recurrence, then I'll honor their wishes, but I need to make sure that they fully understand that their risk of recurrence is actually very low.